The warming of the oceans is no longer a distant environmental phenomenon. It is a driver of economic instability, social disruption, and human suffering. While policymakers often discuss rising seas and stronger storms in abstract terms, the hidden costs of ocean heat are already manifesting in hospitals, homes, and markets around the world. Every pulse of heat that escapes from the ocean triggers more than environmental change. It catalyzes health crises that ripple outward through economies, insurance systems, and social structures, often in ways that are invisible until the bills arrive. The financial and societal consequences of ocean-driven health disasters are profound, accelerating inequality and threatening the stability of communities that can least absorb the shock. One of the most immediate economic impacts comes through healthcare systems. Heat waves, driven in part by sudden ocean warming, increase hospitalizations for heat stroke, cardiovascular strain, kidney failure, and respiratory complications. At the same time, warmer waters drive the spread of waterborne and vector-borne diseases, such as cholera, dengue fever, and Vibrio infections, compounding patient loads. Clinics and hospitals must operate longer hours, hire extra staff, purchase emergency supplies, and often cope with power failures or damaged infrastructure during extreme weather. These costs, though often absorbed at the local level, accumulate quickly and can overwhelm national health budgets, particularly in low- and middle-income countries. Even high-income nations are feeling the strain, as repeated heat waves and climate-driven disease outbreaks force emergency expenditures, push up insurance premiums for healthcare facilities, and increase public spending on cooling centers, emergency transport, and protective services. Insurance systems, both public and private, are directly affected. Health-related claims spike in regions hit by sudden warming events, leading to rising premiums and reduced coverage options. Property and casualty insurers face compounded risks. Coastal homes and businesses exposed to storms and floods are further stressed when residents experience heat-related illness, reducing labor productivity and delaying reconstruction. Workers' compensation claims rise among outdoor laborers, agricultural staff, and emergency responders, while business interruption losses escalate when employees fall ill or supply chains fail due to climate-induced disasters. In many cases, insurers begin to withdraw coverage from high-risk areas or raise premiums beyond what local populations can afford, effectively shifting the financial burden onto households already vulnerable to heat, disease, and malnutrition. Ocean-driven heat also undermines broader economic productivity. Fisheries and agriculture, two sectors intimately tied to ocean and freshwater systems, are directly threatened. Marine heat waves reduce fish stocks, alter migration patterns, and create harmful algal blooms that contaminate seafood supplies. Coastal communities lose income, forcing families to reduce food intake or take on high-interest debt. Simultaneously, sudden droughts or floods in inland farming regions linked to shifts in oceanic circulation destroy crops and reduce yields. These disruptions not only limit local nutrition but destabilize commodity markets globally, causing price spikes for rice, wheat, and protein-rich foods. Economies dependent on food exports, tourism, or fisheries see immediate GDP reductions, while global markets respond to scarcity with volatility, amplifying economic shocks far beyond affected regions. Social systems are likewise stressed when health crises intersect with economic strain. Hospitals overwhelmed by climate-related illness reduce services for routine care, leaving chronic disease patients without necessary treatment. Schools may close during heat waves or flood events, interrupting education and forcing parents to miss work, reducing household income and long-term human capital. Nutrition shortfalls due to disrupted food systems compound both health and economic impacts, producing a generation at risk of cognitive deficits, stunted growth, and long-term productivity losses. Communities under repeated stress experience rising mental health burdens, social tension, and migration pressures, further straining welfare programs, emergency services, and urban infrastructure. In effect, ocean heat destabilizes not just the environment but the networks that sustain society itself. Low-income and marginalized populations bear the brunt of these hidden costs. Without financial reserves, robust health coverage, or social safety nets, these communities face compounded vulnerability. Illness reduces earning potential, heat and water stress destroy livelihoods, and rising food prices limit nutritional access. Economic recovery is slower, leaving cycles of poverty that are both deepened and prolonged. Wealthier populations can often absorb individual shocks, but the structural vulnerability of society becomes evident when repeated climate health disasters push middle-income families into precarity, creating broader instability and long-term inequality. Perhaps the most insidious aspect of ocean-driven health disasters is their unpredictability. Sudden marine heat waves or shifts in currents can trigger extreme weather events and disease outbreaks that were not anticipated by risk models, meaning that both governments and businesses may face catastrophic losses without warning. Emergency funds and insurance reserves are quickly depleted and recovery timelines lengthen. Investment confidence falls in regions frequently affected by heat-induced disasters, limiting economic growth and discouraging development in areas that are already struggling to adapt. This cascading effect means that the cost of ocean heat is not a single line item. It spreads invisibly across industries, communities, and nations. Even indirect costs accumulate. Reduced workforce productivity due to illness, increased absenteeism, and fatigue during extreme heat events lowers economic output across sectors, from construction to transportation to service industries. Public expenditures rise not only for immediate disaster response, but also for preventive infrastructure, seawalls, flood defenses, cooling centers, water filtration, and health system retrofits. These costs divert resources from long-term development projects, education, and poverty alleviation, locking communities into a reactive mode of economic management. The warning is stark. Ocean heat is not a distant environmental concern, but a driver of profound social and economic instability. Health-related disasters triggered or amplified by warming waters amplify inequality, overwhelm insurance systems, reduce productivity, and place an unrelenting strain on governments and communities. If the oceans continue to absorb and then release heat at accelerating rates, the hidden economic costs will escalate beyond projections, revealing just how interwoven climate, health, and economic systems truly are. Societies that fail to account for this linkage risk repeated crises, structural poverty, and widespread disruption, even before considering the full physical toll of heat waves, disease, and malnutrition. In this context, the ocean's warming is not just an environmental problem, it is an economic and social emergency that demands urgent, integrated planning across health, finance, and public policy.